my name is Erica. I will be examining you today as a nurse practitioner, your head, neck, ears, nose, and throat, and your mouth, okay? Can I have you lean forward? I'm going to feel around your head. So it's normal cephalic, atraumatic. It doesn't, I don't feel any swelling. Did you have any pain or tenderness when I touched around? So I'm going to also, since I'm here, touch around your ears and palpate any tenderness here.
No tenderness.
Okay. I'm also going to palpate your frontal area. Any tenderness here?
No.
What about right here?
No.
So I'm going to also go ahead and palpate your carotid artery. It's a graded 2+. Okay. I'm going to feel around here in your trachea. It's midline. I don't feel your thyroid at all. And then I'm also going to palpate over here your temporal artery as well, okay? So this is also a 2+. Next, I'm going to go ahead and have you shrug your shoulders up for me so that feels even resistance, okay? That was assessing your trapezoid, excuse me. Then I'm going to go ahead and have you push against my hand here so that feels nice and strong. And that feels nice and equal and strong as well. So also, since I'm still palpating, I'm going to have you open up your mouth. I don't feel any clicking and no popping of any kind. So that would be negative for the TMJ. Now that I have established palpation, I'm going to just take a look at your, I'm going to listen to your carotid. Okay, I'm going to auscultate. Okay, no bruit here. No bruit here. So, no bruit right there. And I don't see any observable DVD on either side. I'm going to have you look that way. Yep. Okay. So, next, I'm going to move on to your eyes. So just right off the bat, your eyelids, they don't look edematous, no redness. They look intact with no lesions. Your lashes are full and equally distributed on your eyelids. I'm going to pull back your conjunctiva. Okay. So that looks nice and pink. No redness or exudates observed there. Your scleral looks white with no redness or injections either. Also, your optic disc is nice and sharp. So since I'm still here, I'm going to go ahead and check your vision. So with the Snellen chart. So I checked your vision. It's 20/20 in both the left and the right side. I'm going to have you follow my finger, okay? This is just assessing cranial nerve number 2. So far, I've checked his cranial nerve number 6 as well earlier. Next, I'm going to go ahead and have you cover one of your eyes. I'm going to have you tell me how many numbers I'm holding up, okay?
1, 2.
Okay, now your other one.
2.
Making sure that your eye stays looking straight ahead.
2.
Okay. Next, I'm going to have you cover your eye one more time. And I'm going to have you focus on my eye. On my finger. Okay. And now let's try the other one. I see that his eyes are accommodating my finger and able to focus on my finger. So next, I'm going to have you. I'm going to check your eyes actually. So I'm just going to check your corneal light reflex. If you can just look straight ahead or stay focused on something behind me. So the corneal light reflex is equal and symmetric in both sides. I can see it clearly. I'm going to check for your red light reflex as well. Okay. I see the redness. Okay. Next, I'm going to also check your fundus. I'm going to do a fundi exam. So I'm going to have you keep looking straight. Okay. I'm able to see visualize the optic disc when I did that. There was no presence of exudates, no AV nicking observed, and no hemorrhages either. So right now, what I had checked is cranial nerves 2, 3, 4, and 6 in this eye exam right now. So next, I'm going to go ahead and continue to check your ears. So I palpated your ears earlier. There was no tenderness there. So I'm actually going to now, and it looks symmetric from this standpoint. So now I'm going to go ahead and check with the whisper test how your hearing is. So I'm going to say a word and you're going to say it out loud, okay? I'm going to whisper to you.
Blue.
Okay, so that is cranial nerve number 8, and it is intact. So now I'm going to move on to the otoscope exam. I'm going to grab a fresh specula. And I am going to go ahead and set up my cord to cut me some slack. I'm going to carry the otoscope like I'm holding a pencil. I'm going to put it towards facing the straight and facing towards the nose. I'm going to pull your ear up and out to be able to visualize easier. So 3 fingers will be off like a pencil, up and out. So I'm visualizing the external ear canal. It looks clean with no buildup and no lesions or redness inside. I can see the tympanic membrane. It looks grayish and intact with no edema observed. And I see the cona light pointing at 7 o'clock. So same thing with the right ear. I'm going to hold it like a pencil, point it straight up. Next, I'm going to pull up and out. And I'm going to look into his ear. It looks clear with no buildup, no redness. Tympanic membrane also looks grayish and intact with no edema. And I saw the cona light at 5 o'clock. Oh, actually, I'm going to keep this to be able to examine properly the nose next. So I'm going to have you look up. And I'm going to visualize the nasal septum is midline, no deviation, no nasal polyps observed either. Turbinates are nice, pink, and moist. No discharge was observed as well, and it looked patent with no deformities either. So I already palpated the frontal sinuses and the maxillary sinuses earlier, and those were non-tender as well. Next will be the mouth. So first thing I'm going to do is look at his lips. They look like they're well perfused, symmetrical, no lesions observed, and I'm going to palpate his lips. I don't feel any masses, and it feels even. Distributed. I'm going to also now grab a tongue depressor, and I'm going to grab the light again so I can see it. So I'm going to have him open his mouth, say ah. So the uvula rose up with phonation, and it was midline. So that is cranial nerve number 9 and 10. It's intact. Next, I'm going to put the tongue blade inside your mouth. You're going to try to push against the tongue blade, okay? Ready? The left side. Okay. Now the right side. Okay. Equal, both resistant. Next, I'm going to go ahead and observe his gums and his teeth. So I'm going to move this around and just look at his gums. I don't see any deformities. I don't see any issues with the gum line being red. Basically, no swelling, no gum disease observed. Next, no exudates either. Now I'm now going to take a look at his tonsils. So I'm going to have you open up your tonsils again, push the tongue blade down, say again. So the tonsils, I would grade it at a 0. They look symmetrical with no deformities. I also observed the tongue be midline with no tremors as well. That's also cranial nerve number 10. So I'm going to just inspect lastly the soft and hard palate. So I'm going to just feel around using my tongue blade. So no deformities or indications of cleft palate or such observed, and no erythema overall. And the nasal and the pharyngeal wall was also intact with no erythema. That's it.